Well, hello, Facebook family. I am back to talk about the end of week 4 post op from my left hip replacement. So, during this week, everything actually has uh, gotten a lot better. The pain is better, the ambulation is better, even the sharp, burning, stabbing pain that I'm having in my left hip, left, not hip, but left thigh, that is better as well. So everything is progressing. I went to go see my primary care physician, and I'll talk a little more about that. I also was, I think I already talked about being seen and being able to go back to work on March 9th. So that was done. And I also went to the therapist. Now, the therapist says that I'm doing very well, that I should be able to walk without the cane, hopefully within weeks. So she gave me exercises to do that I've been working on and I'm going to continue to work on. And so things are going a lot better. I've learned that no matter how fast you want it to go, it is going to take about 6 months for the hip to heal. And so she gave me some exercises to do over the incision site. And she said that's so that that skin won't bunch up and become real tight and everything. So I am doing those exercises over that site. And so things are going well. They're moving fairly quickly from what I'm told. I'm doing really good. And so, of course, I was in denial and expecting to be doing even better than what I'm doing, but I'm glad that I'm doing good. I don't have any complaints. And so let's talk a little bit about my primary physician. So I went to go see my primary physician, and my main reason for seeing her, not only as follow up from the operation from the surgeon, but also to talk about the GLP-1. So we went over my medical conditions, the few that I have, and she said that they would or should allow me to be approved for a GLP-1. Right now, I have a diagnosis of pre-diabetes and high cholesterol. And also, although she says she don't know how much they'll look at the osteoarthritis, but weight loss, which is my reason, my number one reason for wanting to be on the GLP-1, weight loss will take the pressure off of the joints. And therefore, with less pressure on the joints, the likelihood of me needing another joint replacement in a different area would go down. And so I want to start the GLP-1. So hopefully the next time I am back on, I'll be able to talk about it. I'm trying to go for the trizepatide or Zepbound. So those two are the same, the Zepbound and the trizepatide. Those two have two different areas that they work on in your body. So I'm going to go for those and see if I can start getting some of this weight off so that I can lessen the pressure on my joints and hopefully work with this osteoarthritis and getting that down. And well, I don't think it's a way to get rid of osteoarthritis, but at least to get rid of some of the inflammation. And for sure, I don't want to have another surgery. Although I'm thankful that I was able to have the left hip replacement and that I don't feel the pain the same, because before, I don't know if any of you have ever felt this. I only heard one other person say that they felt like your acetabulum or the bone is slipping out. And, certain movements you have to do to get that bone to get back in place. And when you don't have any cartilage or anything holding it in, it's bone on bone, it's very possible that that can happen. So that was one thing that was happening to me, and it was very painful. So when I was talking to another young lady who's getting ready to have the surgery as well, said that she was feeling that, I totally understood what she was feeling. And I told her that I'm going to give her some of the tools that I used after the surgery that helps you out, like the reacher, the apparatus that helps you put your socks on. I have wedges for the bed, wedges for my leg, all different types of things like that. And as I get better, I want to bless somebody else with those things. So, again, this is week 4. I am progressing on, well, it's the end of week 4. So I'm progressing. I'm going into week 5. And I just pray that anybody else that's had a hip replacement, or maybe you're afraid and you haven't had it yet and you just are thinking about it, let's talk about it. Let's talk about what your expectations are and what would make you actually have the surgery. For me, it was no way that I could get that hip joint to stay in place. And so no matter how much I did not want to have the surgery, it was stopping me from standing up. I would have to stop when I stand up, readjust my body, do different things to try to get that bone to slip back in place. And it just wasn't feasible that I would be able to do that for years and years. And so once the doctor said, really, it's not even with, I don't even think the shots would have helped because of what was going on. So I just went ahead and had the surgery. The surgery itself was not bad. It was over with in no time. They did show my husband the actual area and where the arthritis was and why it was needed to be taken out. So I never got a chance to see it, but they did show it to him. And I'm just glad that part is over. I'm a little impatient, so waiting to heal for me is slow, but I got to do things decently in order. I thank the Lord. I thank the Lord Jesus Christ that he's allowed me to be well enough to even have the surgery. And so, and also to have worked out so much prior to where they're saying I'm doing extremely well. The home health therapist was surprised that I was able to get off of home health therapy so soon. Even the nurse practitioner that gave me the form to go back to work, she was just shocked. Everybody is shocked that I'm doing so well, but I give all thanks and praise to the Lord. And also I thank those that helped me, the therapists at work that gave me exercises to do. And as he said, they would help with, it'll help with with convalescing once I'm at home. And truthfully, it has. So I just wanted to give you all a quick update. That's what's happening with me on week 4. If you have any questions, please don't hesitate to ask. And let's just talk about this. We're going to be talking more about the GLP-1 once I get the GLP-1. And I'm excited. I'm excited about the future and where I'm going with this. And if this is your first time joining, we're just here talking a little bit about things that happen. Happens to young people, old people. Sometimes you just have things where you have to have things replaced. And so right now we're talking about osteoarthritis and having a total hip replacement, which is what I had, a total left hip replacement. We're also talking about the GLP-1s, and I'm talking about it because I am going to have that. And that's going to be it for now. Thanks. Bye.